Good morning, everyone. Welcome to this virtual session in our digital healthcare delivery virtual series. My name is Mark Haglund. I'm editor-in-chief of Healthcare Innovation. And this morning, I have a wonderful panel of experts and leaders assembled to talk about patient engagement, revisioning the patient experience. This is an extremely exciting topic and one we want to say a lot about. And I'm going to ask your forgiveness in advance because I've got a difficult cough. So I'm going to try to mute myself whenever possible, but I couldn't do it while I was introducing myself. So once again, welcome everyone. We're going to be talking about patient engagement, revisioning the patient experience. I am delighted to be joined by Anna Schoenbaum, Vice President, Applications, Digital Health, and Predictive at Penn Medicine. Helen Bremer, Senior Vice President, Employer Solutions and Population Health at TriHealth. Megan Chavez, Vice President, Patient and Family Experience at Cook Children's Health. And Eric Krefley, Vice President of Product Management at Relation. Welcome, everyone, and thank you so much for joining us today.
Pleasure.
So what I'm going to do, I'm just going to go around the virtual circle here. As many people have noted, it feels like we're in Brady Bunch world, right? Look up to Jan and across to Marsha. So I'm going to go to the first person on my screen here, Helen Bremer. Tell us just a little bit about yourself, your role in your organization, and then we'll go on from you. Thank you.
Thank you, Mark, and good morning, everyone. I am Helen Bremer. I am a nurse by training and have been in healthcare for 35 years. I currently work at TriHealth, which is a large health system within Cincinnati, Ohio. We have services that range anywhere from birth all the way through death, with a very large ambulatory footprint, as well as 6 hospitals. My role is just recently changed, where I've become the system chief operating officer. So I have responsibility not only for our clinical operations, but as Mark alluded to, my background has been in population health, of which consumer engagement has been a core component. So it's a pleasure to be here this morning.
Thank you so much, Terry. Great to have you. Next, I see Anna Schoenbaum. Anna, welcome.
Good morning. Thank you for having me. I'm Anna Schoenbaum, Vice President of Applications and Digital Health, and I oversee the Predictive Health team. I am a nurse by trade. I've been in the healthcare field for over 30 years and dabbled in a little bit of that and always talked about technology when I was a patient care nurse manager. And then I pursued my degree in health IT and have been there for about the last 20 years. I also am a faculty member. I teach informatics to NPs as well as nursing informatics students at the University of Maryland. But I'm here to represent patient experience for Penn Medicine. It is a 6-hospital healthcare system. We have about 47 employees. We have close to almost 2,000 practices and about 9,000 providers and over 10,000 nurses.
Wonderful. Thank you so much, Anna. Great to have you. Megan Chavez, please introduce yourself. Thank you.
Thanks, Mark. So Megan Chavez, Vice President of Patient and Family Experience at Cook Children's in Texas. It's a little warm these days. But I've been in patient and family experience leadership for 20 years. And as part of my role here at Cook Children's, we really kind of make sure that we give voice to what our patients and families are experiencing, certainly through surveying, but we have 14 family advisory councils that are deeply integrated into all of our design work, our healthcare IT initiatives, digital experience, et cetera. We also advocate for how their experience impacts their outcomes and their engagement. And a lot of work we do around emotional safety and understanding the emotional harm that happens as part of the healthcare experience and supporting those family dynamics as folks engage with their healthcare. My personal experience is, 20 years ago, patient experience wasn't actually a term we used. And so it's been great to kind of see how the thinking and evolution has happened. But one of the things I identified pretty early on was that in my own career is the role of healthcare IT and the ability to put the power into the hands of our patients and families as active members of our care team. So as part of that, I got my master's in healthcare informatics and IT leadership to help me understand, again, kind of what those tools are available to us. And that's been really helpful as, again, we've started to understand the role that healthcare and digital experience can really play in empowering our patients and families.
Wonderful. Thank you so much, Megan. Welcome.
Thank you.
Absolutely. And Eric Krefley, welcome to you.
Hi, everyone. My name is Eric Krefley. I'm Vice President of Product Management at Relation. Relation is a patient scheduling, engagement, and intake company servicing primarily the ambulatory market, although we do have institutional clients as well. Like my esteemed colleagues on the panel, I too have been in the healthcare space in various roles for a couple of decades now, and really have dedicated my career and my pursuits to the journey of wellness for patients. Like my colleagues on the panel, I'm very passionate about this, and also have healthcare information technology certifications, much like my esteemed colleagues. And just I'm very excited to be here and to share some of the survey results and some of the analysis that we've been doing at Relation and how it particularly pertains to this particular topic.
Thank you so much, Eric. Great to have you. So great to have you all. I love the diversity of backgrounds and lived experiences here. I think it'll serve us so well. Let me begin by kind of framing this in my own way. And if I do a horrible job, please throw rotten tomatoes at me. But this feels like an amazing moment for this topic. As we all know, the entire world has been living with the COVID-19 pandemic for 2.5 years now. It's changed so much in healthcare and has really compelled leaders to reframe everything that they're doing around the patient experience. At the same time, the pandemic had an interesting impact on all of us as consumers in general. And it really, I believe, has made consumers of healthcare more aware of the fact that they have choices. That started early on when most care that could be turned into virtual was made virtual, and people realized, oh, they had different types of options in terms of the mode of care delivery that they experienced. But also, we all have lived through the experience during the pandemic of ordering a lot of things online, retail, and having very high expectations of customer service. You would order an item of clothing, let's say, and you would expect that it would arrive in a very timely way. It would be what you expected, and if it wasn't, or if there was some problem, you could send the item back, either get a refund or get it exchanged. Sometimes they would even send a box within a box so that you could, there were a lot of mechanisms that people got very used to as consumers in terms of services. And that is really, I think, impacting how consumers think about healthcare now in new ways. Maybe not always directly, but it's in the backs of our minds, right? The other element of this, of course, is even before the pandemic began, people were beginning to talk about the digital front door. They were beginning to talk about how, about marketing in a new way, not just, sending out brochures, but really how you think about your patient care community as an audience. And of course, the pandemic changed how we thought about this. So I think it's a really interesting moment because leaders like all of you are working in an atmosphere of heightened awareness. So what I'd love to do is ask, let me turn to you first, Terry, and ask you a little bit about the comprehensive plan that you are helping to lead and have been helping to lead at TriHealth. You started with a pilot around enhancing patient engagement and then expanded that broadly and have really been thinking about consumers. Tell us a little bit about that, if you would.
Yeah, I'd be happy to, Mark. So I think your intro or words of wisdom, we have been on this journey of consumerism and patient engagement really aggressively over the last 5 years. And I would add that the Amazon experience and the younger generation has really challenged us to think differently as healthcare providers. But we started with looking at how do we partner with folks that did this well. So we partnered with a company called Cincinnati Consulting Consortium that were made up of ex-Procter & Gamble executives who were experts in marketing, consumerism, and insights, and actually had developed a tool that looks at people's psychographics. Psychographics is obviously focused on people's attitudes, their beliefs, their personalities, their values. And when you segment that, you can actually get into what we call a psychographic segmentation. And we were interested in that because we were in the corporate health arena and really wanted to increase our uptick in getting people into behavior change. So we implemented a pilot that we took our health coaches and 3 different employer segments and over 2,000 individuals. And we actually applied the psychographic segmentation to the health coaching population. And what we found was really remarkable. And that was, we were able to get to behavior change that was sustainable. We saw, I think, almost a 30% increase in reduction in risk. So if they had health risks, we were able to reduce those risks through proper engagement with the health coach and the individual. And it ended up being a pretty significant return on investment of like a 5-to-1. What that did for us is it really gave us a holistic view of the individual by integrating consumer data with clinical data, with work-related data. So we had this prototype of the individual that we were caring for. We then took that pilot and said, if we can do this in the employer segment, how can we apply this to the clinical realm? And then we applied this to a pilot within our heart failure area, where we took about 880 patients that were having care management intervention, and we applied psychographic segmentation and interventions to that population. And what we found is we were able to reduce readmission rates by 53%. Some of the learnings out of that was really around the provider side, whether it was a health coach or a nurse case manager or a social worker, that said they learned how to communicate to the patient in the manner of their segment, their psychographic segment. And then we were able to use digital platforms so that we could do either automatic messages or texting or emails or apps, whatever was the preference for that segment. And that really got the connection with the consumer. That was really our starting point. We're now ready to scale this across our system into all clinical areas, and more importantly, connect it to a more holistic approach. And as you said, Mark, really looking at how do we get to a digital front door. So we're now overlaying this into our website that drives consumers into our system. And then, of course, we have the tools and techniques to get people access digitally through their apps. So just lots of work in this comprehensive model, but we expect really great gains. And I would just close by saying that all of this for us was possible because we actually have a grant making component to our organization called BI3, actually funded the seed money for us to do these pilots. And then obviously we moved over to operational scalability when we were able to do that.
Well, that's terrific. Thank you so much, Terry. I love those insights. And that segues beautifully to my turning to Anna. Anna, you've done a lot of work around data and around clinicians and helping clinicians to understand how they can help optimize the patient experience, because we all know that nothing will happen unless we can engage the clinicians. So tell me a little bit about how your team has been working with clinicians and thinking about optimizing the patient experience at Penn Medicine.
Thank you, Mark. And Terry, that was a great leeway and such great work at TriHealth. Penn Medicine is similar to TriHealth, is continue to re-envision the patient experience. I agree with you. COVID really turned our world upside down, and we're just using, what tools do we have? What new tools do we need from digital transformation to just modernizing healthcare And we are trying to meet where the patients are at, where they want the care, and to really understand our consumers in our rich environment of technology. We have several projects, and I'll only highlight a few, but regarding our focus on patient access. And we have clinicians participating in this effort. So how to improve our digital front door. And we're looking at maybe 3 workflows, just to name a few, is the new patient visits. That workflow is very different. And how do we get them to know about pen medicine and which doctors, and try to streamline that in a very quick process? How do we continue with our existing patients, especially with those chronic disease? And that's where population health management comes. We want to make sure that we are following those patients. And those are really important in working with our providers and providing them the right data at the right time from a visualization standpoint, so we can track and monitor those patients. And then we want to make sure that we have intense episodes of those types of patients that need to come see. We need to maybe fast track those and make sure those are seen quickly. So that's kind of in the ambulatory world. We are also focusing on inpatient and hospitality, and we just opened up a new building last fall. It's called the Pavilion, and we have added the state-of-the-art technology in that building because we want the patient to have a wonderful experience. Our philosophy there is comfort and control. We want the patients to control their experience. We want them to be knowledgeable, and a knowledgeable patient really helps the provider and also helps in the outcome of their care. And then if I move into the home health arena, we're also looking at the hospital at home. Right now, our home health patient population is up at the 7,000 census rate. But now we're also looking to do the hospital at home because we know that patients want to be at home as quickly as possible. So we're looking at a whole spectrum, very comprehensive. Like Terry, we're looking at holistic care as well.
Wonderful. Thank you, Anna. And one of the great things, we've also benefited from some of your colleagues speaking on programs, including John Donahue, who has shared with us all the incredible complexity behind the planning for the pavilion, and how I was so admiring hearing how all of you on the team were really thinking about the patient experience and not just saying, oh, we hope patients like their beds or something like that. I mean, really thinking through what would be inpatient rooms, how the pavilion would be configured, the technology needed, all of these things. So it's great that you made it all connected, which is great. Thanks. So Megan, I love that you're in the pediatric space. I'm sure you do too. And one of the things that I've known about for a very long time, of course, in the pediatric space in particular, it's about the families, because obviously you can't just engage a 3-year-old by themselves. It's going to be about the parents and the families. And one of the things that I know that you've been working on is really thinking about process and thinking about your frontline people. So if you wouldn't mind sharing a little bit with us, and I know you want to, inside that, share a little bit of case study about something that happened in your clinics and something you figured out there, but let you begin.
Yeah, absolutely. So having worked in both pediatrics and the adult world, one of the things I love about pediatrics is that we really do look at kind of the emotional journey and how this is such a life-defining time often for families. It changes the dynamic, it changes how we view healthcare, right? And I think there's so much for us to carry over into the adult world in that respect, really thinking about this life-defining time often for individuals and caregivers as a whole. So one of the things that we've really been thinking about, especially through the pandemic, is there's so much we do to protect that dynamic and to engage our kids and our families with our on-site services, right? So we have facility dogs and art therapists and all of this stuff, right, to kind of help make this experience feel comforting and safe. And so how do we do that in the digital world? And so thinking very intentionally about what that looks like, and the true marriage of, humanity and technology, connecting people to the right resources. So something as simple as our Parents for Partners program, where they're literally, parents are calling into the hospital room for folks that have been newly admitted or newly diagnosed, just kind of having that friendly voice and saying, here's some of the things that I wish I would have known, and you're not alone in this. How do we replicate that in the digital world? So just thinking really about, again, the digital world being another place for us to expand that kind of holistic care that is so important. But one of the ways that we always approach improvements is not only by hearing directly from our patients and families and having them arm in arm in design and in pilots and all of that, but is our frontline folks. It's our nurses, it's our unit secretaries, it's of course our doctors and everyone else. They're the ones that know the reality of delivering these experiences both digitally and in person. And so we've really doubled down on our patient experience champion program, which is frontline folks that their day jobs are doing all those roles I just talked about, but they have the time and space every month to come together across the system and work on very specific projects aimed at improving the experience. And so it's allowed us not only to make sure that we've got consistencies and best practices that are scaling, all boats are rising, but also a place for us to hear from them about what's the reality of this? What does this look like for you? What are your ideas? And the other thing that the pandemic has reminded us of is that what our patients and families experience is directly connected to their engagement and well-being. And so again, what does that look like for them? So one of the projects that we worked on, which is just a very simple concept, but I think it really kind of brought home to us to not overcomplicate these solutions sometimes, is that we saw an opportunity in one of our neighborhood clinics, which is primarily underserved populations. And it was around our front desk staff and the role that they play in that kind of first engagement with our patients and families. They're balancing portal messaging, they're balancing phone calls, they're balancing the people walking in through the door. And we saw that they had a big impact on patients and families' perceptions of their care. And so we started to engage them in what does that look like for you? And long story short, what we found out is it wasn't a patient experience problem to be solved, it was an employee experience. And so that allowed us then to support them in improvement efforts around what do they need to feel good about their job? What are the tools that they have? What is the reality of balancing all of those things and still feeling good about the work that I'm showing up for? And so it allowed us to pivot. And when we were able to do that and solve some of those problems for them, the patient experience scores went up. So it's just, I think, again, another reminder of how all of these things are integrated and that digital is one of our many tools. But I think taking that step back and understanding what does this experience need, this ecosystem need, and engaging folks in that solutioning is really powerful.
Yeah, absolutely. Great examples, Megan. Really appreciate it. So Eric, turning to you, what do you and your colleagues at Relation see on a nationwide level with relation to what all the other panels have been describing? And I know that you have some survey numbers that you might want to share with us, some survey results. So what do you folks see?
Well, thanks, Mark. And thanks again for inviting myself and Relation into this discussion. When I'm listening to Terry and Anna and Megan, they really teed up exactly what the purpose of our surveys recently were. In June, we sent out surveys to our customer base. We are nationwide. We had a really great, about a 3% response, which is excellent when you're surveying into healthcare providers and getting them to take a survey and respond. And then we also sent out a survey to patients and consumers. This survey was very easy to take. We asked some really great questions, and we got about 300 respondents in the patient survey itself. So we're very excited about the sample that we have from our providers and a wide sample that we have from patients and who are consumers. Some interesting statistics around that on the patient survey. For example, 90% were between the ages of 18 and 54, 56% were female, and 66% reported they were managing an ongoing or chronic healthcare situation. So we're very interested to see what these results were. So when Terry was talking about the impact for her at Tri, my mind was going a mile a minute, because one of the things that we saw in the survey results from staff who were dealing directly with patients, and Megan, this kind of dovetails into what you were saying as well, was they reported 60% believe that communication can negatively affect patient outcomes. Now, and I think that we all know that when a person feels alone in this process, they're less likely to do, their treatment plan adherence, medication adherence, follow-up appointments, et cetera. So weren't really surprised by that 60%. But here are some interesting numbers that came out. 82% of those responded that contacting and coordinating with patients about their appointments and follow-ups was a direct cause of their burnout, and 88% reported a moderate to extreme burnout level. So we know that in patient access, and I'm very proud to say that's where I started my career, right there at the front desk at a level 1 hospital in San Diego. But being right there when you're right directly in front of a patient and or their family member, the first thing that you're taught is that nobody wants to be there. So you have to express that compassion and that understanding and learn how to communicate with those folks the way that makes sense to them. And our survey really did drive that home. Some other interesting facts around this survey was that, improving patient flow and reducing no-shows well above the 50 percentile in the respondents. And then also patients, about 73% reported that they want to fill out their paperwork and be made aware of their upcoming appointments so that will save time in the office and being prepared for that visit. So everything that my esteemed colleagues here have been saying really dovetails into that survey. Here's an interesting one that I'll stop at this point because I can keep going on these statistics probably for a full hour of my own. Patients expect online scheduling to be less than 2 to 3 minutes. Mm-hmm. So when we think about that digital front door, mm-hmm. They want to use these tools. 85% said that they want to use tools from organizations that they trust. So as you're looking at building trust is really the starting point of, is a patient going to be involved in their journey to wellness? Establish that trust. They will use the tools if they are easy to use and they don't encumber their ability to schedule and then be engaged as they go through this process. One of the things we say here at Relation is that the relationship between scheduling and patient engagement needs to be symbiotic. They are not separate. They work together because you want to keep that patient engaged not only for that encounter, but also post-encounter. Your engagement strategies should not just be reactive, they should also be proactive and staying in touch with those patients. And our surveys prove this point beyond our expectations.
Well, thank you so much. Those are fascinating results. I could comment on every single one of them. But one of the things that really struck me, Eric, was that patients said that they expected to be able to complete online self-scheduling in 2 minutes. Mm-hmm. That's pretty quick. I think, and I'm a consumer and a patient myself too. I think one of the things that has really crested is expectations around service and convenience, right? I will tell you I'm sure everyone on this panel has personal stories to tell you. I will tell you one personal story. This happened nearly 20 years ago, but it's still in my mind. My employer had switched health plans. There's a surprise, right? And so I was given this panel of providers and I didn't know who to choose. I had no particular familiarity in my local area with providers at that time. And so I went to this one physician, took his name off the list. I got to the waiting room of the clinic and they took my information. Of course, I was filling it out, pen and paper at the time. And it seemed like it was taking forever. It had been like 45 minutes. I was sitting there and I asked and the the lady at the front desk said, yeah, it's probably going to be 3 hours before you're seen.
Ooh.
And I said, she said it very like, oh, it'll be 3 hours. And I thought, my God, do you think I have nothing to do during the day? Right? Like
That's
I'm
terrible.
playing tiddlywinks. And I saw that physician who was kind of mediocre as a clinician too once. And then I was able to get a personal referral to a physician with whom I stayed for many years. Of course, that is becoming intolerable now. But my point in sharing this story is there was an expectation on the part of, well, you know, will hold harmless anyone on this panel, but some provider organizations that, yeah, patients will be patient, right? They'll sit in waiting rooms for long periods of time. Well, the pandemic kind of smashed all that, didn't it? And now, partly because of, you know, the infection control concerns unleashed by the pandemic, many organizations are trying to go to
Telehealth?
virtual waiting rooms where you might be in your car, or there might be some other way, but where you aren't actually sitting in a room for 45 minutes waiting to be seen and potentially spreading germs and having them spread to you. So how does everyone on the panel see this issue of rising consumer expectations in the wake of what we've all been through over the last years? I know, you know, and Terry, you specifically had referenced it. A lot of organizations were working on the patient experience before the pandemic, but then it kind of changed the landscape of everything. How are you all seeing rising patient and consumer expectations right now? Who would like to share first?
Well, I can jump in there. So I think you hit the nail on the head, Mark. We are experiencing the same thing where our patients expect high quality. They expect to get in when they want to get in. They expect us to meet their expectations and this immediacy. And so we have to rise up. And it's important because our consumers have a voice. And what we're also seeing is disruption come into traditional healthcare, which is really challenging those who are not embracing looking at this through a different lens, that you must look at it through a different lens if you want to survive, because that is the way of the consumer world right now. So we actually welcome it. And I think the pandemic actually helped us get our physicians to change their mindsets, to be more willing to shift from, and I say this respectfully, but where the physician may be at the center of the care, but rather now it's the patient at the center of the care.
Yeah, exactly. Who else has perspectives on this?
So Mark, I want to piggyback on Terry. The number one response in the patient survey as to why they would choose a specific provider was location. They want to be close to where they work and or live. And number two was availability. So you mentioned that Amazon model at the top of this. That is definitely the mindset. I want something close and I want something quick.
Yeah, absolutely.
I think the other piece of that too, Eric, you know, you talked about the role of trust. And I think that, you know, that really is our true north.
Yeah.
And even Mark, in your story about talking about waiting, it's, you know, are they not considering me in this? And so I think sometimes we dismiss convenience as nice to have, but if you're really sick, you'll come to us. But what we found is that it does impact that relationship. It does impact that trust, because it's, if you don't see me as an equal and that my time is just as valuable as yours, what else do you not see or value? And so I think we have to connect those dots a bit to understand it impacts the relationship. You know, it's not just purely convenience that I want things on my time and, you know, millennials and all that good stuff, right? It's really about making sure that both people feel valued in those conversations and in that relationship.
I think that's exactly right, Megan. And also I think that younger people, people younger than me, and I'm ancient, so younger than ancient people, are not, you know, survey after survey is finding that they will choose convenience over an established relationship with a clinician. So it's a little bit of a different world now than it was even 10 years ago. I'll tell you one other story because I love telling this story. My grandmother was born in 1888. I was adopted, so my parents were much older than most parents my generation. So my grandmother lived with us growing up. She was my mother's mother, and obviously she had an amazing life experience. She remembered the Spanish-American War and the influenza epidemic of 1918. But she was of the generation that totally was not only trusted their physicians, but basically obeyed, and didn't question. So if her doctor said, Mrs. Fenner, take the blue pill, she took the blue pill without question. That has completely reversed itself now, right? Younger people, I remember interviewing a physician at Palo Alto Medical Foundation in Palo Alto. And of course, half the people there are either Stanford faculty or family or students or whatever. So he told me, and this was nearly 20 years ago, people would bring in printouts of New England Journal of Medicine articles and things like that and say, well, have you considered this, possible scenario? So it's just flipped completely. And I think I agree with you completely, Megan. And I also think that patients now, they use the internet for everything in their lives, right? So they can use the internet to figure out, a different provider, right? And I think that's where the processes behind the patient experience, behind the digital front door is so important. And I know, Anna, you and your colleagues at Penn have really been thinking this through because you recognize that process is so incredibly important in this, right?
Yes, absolutely. I think patients are well-informed, are more engaged, and have higher expectations. They want information at their fingertips. And so we did that with the new hospital. As you were mentioning, we have this whiteboard called Iris, and it has information there so that they know who their care teams are. And then they know what procedures are going to happen, so they understand their day. But they expect that type of information so that they can go on understanding their discharge plan. Mm-hmm. We did do another thing at implementing at Penn Medicine is regarding education. And this education is along the patient's journey. And so it begins in the ambulatory care area about what to expect for a surgery, like for a knee replacement. And it really just takes them through the whole process of what it means.
Yes.
Education on pre-op and post-op. And just like in today's world, they're little blippets of like YouTube videos, right? They're just little snippets. So if you forget something, you can just go back to that post-op exercise. Because that's kind of our mindset. If they want things quick, they want it short, and they can just go to that direct video on how to do their pen care if they had knee surgery.
Yeah, wonderful. So great example. So what are the biggest challenges of any kind that you all, sorry, that sounded very Texan. I was thinking of you, Megan, that you all are facing, and how are you overcoming those biggest challenges? And they can be of any kind, process, technological, research, any kind.
Well, I'm happy to jump in again. For us, I think we have a few challenges. One is just starting at the mindset shift. So, we are a large organization. We have over 1,200 providers, 13,000 team members, just trying to get everybody to think through a lens of that consumer experience, because not everybody thinks of patients as consumers. And that is particularly, I think, relevant with our nursing staff who don't always see it through the lens of consumerism. So just changing that mindset. So how we're handling that is really embedding consumerism within our core strategies as a system, so it doesn't become a flavor of the day or a one-off, but rather part of who we are. I think the other thing is coming out of COVID, it's just being able to manage the pace of change. Things are happening so quickly and so fast and furiously. Every time you turn around, there's a new entrant into the market, there's a new something, and folks are still exhausted from the past 3 years of very intense healthcare. And so trying to balance that. And we have started some well-being listening tours to really understand from our physicians and our caregivers and our staff what they personally need just to be able to kind of get back into our new normal and do it with a healthy approach.
Wonderful, wonderful. Eric, what are you hearing about the challenges and how provider organizations are overcoming them?
So piggybacking off Terry and Anna, I'm really curious, how you guys are addressing it at Penn. Megan, I completely identify with what you guys are doing as well. For me and at Relationed, we keep our eye on the fact that healthcare and the delivery of healthcare is almost an emotional type of experience for those that are receiving care and those that are even delivering care. And when you were talking about, getting into that mindset of the nurse, and the word that comes to mind is when we're looking at solutions and we're looking at ways to increase patient engagement, while it's important for us to remember that there is an emotional aspect of the delivery, the data around what is actually happening will remove that bias. So it's very important, and I see Anna shaking her head, yes, put in the plug for informatics, is that the data should be able to guide you in terms of what the consumer will accept. Amazon, YouTube, the world has changed. The digital front door, I mean, how many of us go to Starbucks now and pay for our lattes with our phone? There is that expectation now. When you take a look at the data and you compare it to the emotional experience that's happening, to me, that's where the solutions lie. Now, those solutions should be your process, should be the vendors and the applications that you work with, how you reach out to those patients. One size does not fit all. I loved the psychographic play, and we're doing the same thing at Relation. An 18 to 24-year-old female will not respond the same way that a 54 to 60-year-old female will. You need to have different content. You probably have to have a different engagement strategy based just on that psychographic, based on those demographics. One size does not fit all. Sending out an appointment reminder does not actually decrease a no-show rate. And we all know that if a patient doesn't show up for their appointment, you really doesn't matter what the treatment plan is or their adherence to it. They have to be an active participant in the process. So for us, it's really paying attention to the data, providing good solutions and guiding our customers, the different practices that we work with, on what are the best ways to communicate. Do some demographics appeal more to a voice message versus an email? Is the content, especially post-discharge, don't ever text somebody their post-discharge information. You send it to them in an email because they're going to take time to read it and to go through it, and offer a chat function so they can actually chat with the practice. Because when they're being discharged, the discharge practitioner turns into Charlie Brown's teacher at that point. And all they hear is, wah, 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 wah. So really follow up with that and keep that patient engaged all the way through.
Yeah. And I think that's another interesting element of all this. I'd love the other panelists to respond to this. Patients are different, right? We're all different people. We may even be different from our spouse or partner or our best friend or our cousin in terms of how we might respond to something. How is everyone thinking about that? The psychographics and the demographics of patients and what they might need as individuals.
Absolutely. I can step in here is that I think if you were to take in every aspect of the patient stay or the patient entering the system, you really do have to look at it from different angles. Everybody learns differently, everybody absorbs, and it takes time. And so that information, that you have, has to be in different bite size, and also in different modalities or methods. So if you need it to go by text, by the patient portal, or by paper, you need to have those things available for the patients. We do that with our discharge instructions because people are truly overwhelmed. Yes. And so we may give it to them, but it goes into their portal. And then also if it's related to a video, it'll be in their portal or they'll be able to access it. But you do have to look at it. And that's the way we're looking at from the entry of patient access. people are going to be coming in different ways. And again, to meet expectations, you need to do it expeditedly. One of the things is when we're choosing solutions, though, we are really looking at high reliable solutions.
Yeah.
And that's really important, is because you can't just put a Band-Aid on it. You got to figure out the workflow and the sustainability and the support model. Because again, going back to trust, what Megan said at the very beginning, you need to have that trust, and you can't have that system or that process fail.
Yeah, absolutely. And Megan, can you address this in terms of families? Because individuals are different and families are different.
Yeah, I mean, I think the ways that you could segment are endless, right? I mean, we all know if you're a parent of multiple children, how different people that, share DNA and grew up in the same household can be. So I think, always having that option and allowing for some self-navigation and self-selection too. I think sometimes we try to put people in boxes too quickly, and really allowing that flexibility and that multimodality that Anna's talking about, so that you've got kind of those checks and balances and can reach them where they are. The other thing that, we've really thought carefully about is health equity. And what are some of the psychosocial factors that prohibit me from accessing or engaging healthcare in the way that I would want to? That we've certainly learned a lot about that through the pandemic as well. And we've talked a lot about making sure that people are receiving care in the language of their preference. Certainly I can get by speaking English, but am I really understanding what you're saying? And how is that non-negotiable? Right? I mean, that's, to my mind, basics, right? If we can't speak the same language, how can we communicate? And so what does that look like in person versus digitally? How do we support caregivers that might play a more active role in care navigation, et cetera? So I think
thumbs up, Megan, thumbs up.
Great. Yeah, no, I mean, I think data helps us so much to get really closer than we've ever been, but there's always going to be that variable, right, that we need to allow for some self-navigation and selection to make sure that we're reaching folks in the right way.
Absolutely. And I think one of the things that has been said here, that Anna mentioned it explicitly, that the discharge summary is going to go into the portal as well, because I don't know anyone who doesn't feel a little bit overwhelmed when they're being discharged, right? It's like, first of all, you've been very ill, obviously, otherwise you wouldn't be in the hospital. And I'm sure a million things are going through your mind, and you may not be really all there at that moment. So it's so important to have all these channels open. What do the next few years look like on this journey for the healthcare system, both for all of your own organizations and for the U.S. healthcare system overall? How will this landscape, in what ways will this landscape look different if we have this conversation 2 or 3 years from now? Who would like to go first?
I can kick us off at least. I think we've been in such a reactive mode for the last 3 years. I mean, frankly, on many fronts, scrambling, right, to catch up with the latest information or the latest, visitation changes. And, maybe we need a virtual visitation, just kind of that constant reactiveness. And so I think it's also been a time, and this happened through the pandemic too, for us personally, for us really to get back to what really matters, really that simplification, because I think we've gotten so busy and chasing so much and being so reactive to disruptors and everything like that, to really hone in on what are the fundamentals, what are the things that we really need to create those trusting relationships with our patients and families and with each other. And starting from there and pulling those initiatives back together so that we can start to see, the long road ahead, versus this constant kind of trying to keep our heads above water. So I'm excited about that concept, because I think it gets back to the heart of healthcare, and really kind of creating more of that human experience that we're all part of.
Yeah, absolutely. Other views of the future?
I'll add in a little different spin. I like what you said, Megan. I think what I see is a few things. We're on a population health journey, so that's really moving people out of the hospital and more into their home environment or an ambulatory setting. So I think over the next few years, we're going to see a really considerable expansion of technology uses, and how do you really get your healthcare through your smartphone. So that's just going to continue to expand and get explored. I think that's going to challenge us at the national level, because CMS and CMMI are going to, they want to look at different alternative payment models and different care delivery models. So I think you're going to see hopefully an uptick and some innovation there that can help meet that consumer where they want to meet. That's also going to challenge the payers, because right now, while the payers were paying for telehealth through COVID, there are things going on where that may not be the way of the future. And yet that's what our consumers are demanding. So the payment models, the mechanisms for financing are going to have to be impacted. And then I would finally say that, out of all of this, I think it's really going to be around just changing how we meet that consumer, and our consumers are really going to be allowed voice, and that voice is going to continue to increase, and it should, and we are going to have to keep up with that pace of change. So just a lot of explosion here with ideas and innovations.
Anna, do you have any thoughts on the landscape of a few years from now?
Yeah, so I think it is going to continue to be rapid. I think technology is going to be evolving very quickly. I think data is going to be available, and if you use it wisely, I think there'll be cognitive, predictive AI probably driven solution. Again, I warn a little caution to make sure that those are validated and scalable. But also, I think that the setting of healthcare, to Terry's point, is going to change. It's going to look different. You got to be ready where the patient wants to be seen, have the technology there. And then I would say to promote interoperability of sharing that data, in secure fashion, private fashion, because we're all good stewards of that data. And I think that's real important as we get to open this landscape up a little bit. We need to really be cautious going forward.
And I think I'm glad you mentioned interoperability, Anna, because a lot of stuff is going to happen. And we're all waiting to see how TEFCA plays out in the next year or two. It could really help us with the patient journey, with the patient experience, because the better connected we are, the more information that patients have, the better. And when we talk about patient engagement, it's such an interesting concept for me, because I think people hear different things in that. And some think of patient engagement, maybe not consciously, but as almost being like patient compliance, right? Mm-hmm. Patients will take their meds, they'll listen to their care coordinators and care managers. But really, it has to be much broader than that. The patient has to be empowered to really want to fully engage. And I think that information will help them. And once we get the cue hints established, there will be more information that will flow around more freely. And that may help stimulate things further. Mm-hmm. So we have just enough time for everyone to leave our audience with one piece of wisdom, one piece of advice or thoughts for what they might want to know as they move forward on their journey. Every one of you is moving forward on a really excellent journey, and I think you have so much to share. But let's start with you, Eric, and the national viewpoint. One quick piece of wisdom for our audience.
Technology is great when it works. And I'm oversimplifying the situation, but like Terry was talking about quality and value, and Anna was talking about data access and interoperability. Make sure that your technology is moving your patient's experience in a manner that works for them and it works for you.
Great. Terry, thoughts?
I would say stay persistent as a change agent. This is not healthcare system is still somewhat traditional, so it's going to take individuals that are willing to make the change to stay persistent.
Wonderful. Anna, what are your thoughts?
Always keep the patient in the center. Then you will select the right solution. You will create the right experience, and you will protect the data for that patient.
Wonderful. Everyone's so succinct. We're going to finish early here. Megan, you can be long-winded. No, I'm just
Ah,
teasing.
oh no.
Go ahead, yeah.
I mean, I think all those points are absolutely excellent. I think the other thing I would add to that is don't be afraid. As a matter of fact, make it a requirement to have your patients and families, your caregivers, your team arm in arm with you through this. And identifying what's the right problem to be solved and what are our options for doing that. I think sometimes we do that as kind of the check the box. We'll design it and then go do a patient focus group and validate that what we thought is working. But I think from the onset, really thinking through that human-centric design. We've all talked about how fast things are moving. We can't assume that what we researched 18 months ago is still relevant. And so I think having those folks, right there with us, and thinking about not only how will this change the patient and family journey, but how will it change the staff and physician that are supporting these journeys as well. I think it's just so important for us to keep all of those things in balance and engaging them in that process.
Yeah, I absolutely agree with you. Every one of you has shared wonderful wisdom. I think I would summarize and synthesize a little bit by saying the next several years in healthcare in this country are going to be fascinating. Fascinating includes challenging and at times exhausting. But one of the things I always hearken to is, every year the Medicare actuaries project national expenditures, total national healthcare expenditures, how much we as a country spend on healthcare in all forms. Well, their latest prediction earlier this year is that we are going to go over $6 trillion a year in sometime in the next 5 years. No, by 2030, excuse me. We're already at 4 trillion now. And wait, did I say 6.78 trillion? I think was the latest figure. Anyway, it's just completely mind-blowing. You're getting into really huge numbers. And as we all know, we're struggling as a nation to pay for all the healthcare that we're providing now. So when we think about the fact that it's going to become much more expensive, and a lot of it is driven by factors we can't control: the aging of the population, the explosion in chronic illness. There's simply, those are facts, and those are demographic trends. So it's going to be an interesting thing because hospitals, medical groups, and health systems will always be working with somewhat straitened funding. There will never be great wealth and just dollars coming out of fountains. So there will be a lot of ingenuity required. But the good news is there's so many smart people, including all of you, of course, in healthcare, really, really brilliant people. And I think we will get there. I think it'll be challenging, but I also think I do have some hope, because the discussion that we're having around this virtual table today shows me that there are very, very many really thoughtful leaders and thoughtful organizations that are moving ahead on all fronts in every area that we need to. So I think it'll be an exciting time. And I also think that this whole patient engagement, patient experience topic will start to mature pretty quickly as people figure out solutions and learn from each other, learn from what all you folks are doing.
Hey,
So,
Mark, why don't you get all of us together in 2 years and see if that's all true?
I think that's a great idea, Eric. I think we should do that. And yeah, I mean, and the last thing I'll say is harkening back to my cover story on the empowered consumer that I wrote in 1991. I think it's really happening now. So the next few years will be exciting. So I just want to thank all of you. This has been an absolutely wonderful session. And while you hang on here for 1 second, I'm just going to preview for our audience what they'll be seeing the rest of today. We've got wonderful sessions following this one. So I hope everyone will stay tuned in, because we've got a session on using consumer industry methods to enhance patient engagement, digital care journeys, the new trend in patient engagement, and physician strategies that need to embrace new approaches to drive patient engagement and near-term growth. So what we've been talking about now will be elaborated on in some very specific sessions following this one. So I hope that everyone in the audience will stay with us because we have much more to come today. But in the meantime, I want to thank Terry, Anna, Megan, and Eric for just a terrific, terrific discussion this morning. Thank you all. We appreciate it so much.
Thank you, Mark.
Mark.
Thanks. Have a good day, everyone.
Thank you. Have a great day, everyone. This concludes the session. And as I say, more sessions will follow. Please check the website and it gives you a whole catalog of what's happening next. Have a great day, everyone.